Hey, good morning. Thank you all for participating in today's media briefing. This is our 24th since the start of the pandemic. These press conferences are a reflection of UPMC's ongoing commitment to provide timely and accurate information to all. Today I'm joined by Leslie Davis, UPMC's Executive Vice President and Chief Operating Officer of the Health Services Division, Dr. Graham Snyder, UPMC's Medical Director of Infection Prevention and Hospital Epidemiology, and Dr. Don Yealy, UPMC's Senior Medical Director and the Chair of Emergency Medicine. They will explain how UPMC has activated its preparedness plans to manage our capacity and staffing levels so we can continue to provide world-class medical care to our communities. They will also discuss our preparations to receive and distribute COVID-19 vaccine. After their remarks, we will take your questions. Leslie.
Thank you, Paul. Good morning. As we are seeing across the U.S. and in many places around the world, the communities UPMC serves in Pennsylvania, New York, Maryland, and Ohio are experiencing the highest numbers of COVID-19 infections and hospitalizations since the start of this pandemic. At UPMC, we have prepared for decades to provide essential, life-serving care for our communities under any circumstances. Long before COVID-19, UPMC created extensive contingency plans. We have spent the last several years preparing by developing the UPMC experience, creating outstanding experiences for all of our patients and all of our employees. And now we are able to use those skills, the knowledge and flexibility to manage the growth in COVID-19 illness, just as we've done in other periods of high patient need. For example, we have brought in nearly 200 nurses in the past week to provide additional staffing as we expand hours of care. And we have also expanded the hours of all of our flex time staff. We have found opportunities to quickly add additional beds across our system. At UPMC Mercy, for example, we accelerated the opening of a new intensive care unit just a few days ago, and at the same time, we transformed the older ICU unit into a step-down unit, creating a dozen more beds for patients. Another example is UPMC Altoona. With a spike up in COVID-19 infections in this part of the region, we have effectively worked with our sister hospital to create more staff, more equipment, and of course, more support to the terrific caregivers who are taking care of that community. We have carefully gathered and analyzed our data, and we have shortened the quarantine periods for our employees from 14 days to 10 days, and soon to 7 days, so that staff without COVID symptoms can return to work more quickly, a move that has now been echoed by CDC guidance. And we are implementing other clinical strategies, such as better understanding which COVID-19 patients we can send home with pulse oximeters and other support. And finally, we continue to expand our use of telemedicine for inpatient and outpatient care, reaching a record of 1 million ambulatory telemedicine visits so far this year. If necessary, we are able to flex up the number of beds, both medical and intensive care beds, to meet the needs of all of our patients. Fortunately, we've gotten smarter about caring for COVID-19 patients, and we are seeing a far lower proportion of critically ill patients needing intensive care and mechanical ventilations or breathing machines than we did in the spring. Today's COVID-19 census represents only 20% of UPMC's overall bed capacity. UPMC healthcare workers and healthcare workers everywhere, you are so essential. It is because of our 92,000 employees and their dedication to caring for our friends, our neighbors, and our families that UPMC is so confident in our ability to continue providing the medical needs of our communities. To our devoted and resilient workforce, we thank you. And now for some much anticipated good news, Dr. Graham Snyder will tell you about our COVID-19 vaccination plans. Thank you.
Thank you, Leslie. It is good news. As we speak, hospitals around our network are preparing to receive thousands of the doses of the Pfizer COVID-19 vaccine. We also expect the Moderna vaccine to be arriving soon at our skilled nursing facilities. This is only our first allocation, and details of future allocations are forthcoming. Given the robust production of vaccines already underway, we are optimistic we will be able to provide vaccine to our frontline healthcare workers who wish to receive it before the end of January. UPMC has a capable team coordinating the logistics of vaccine receiving, storage, distribution, and immunization. We are highly proficient at these processes, particularly given our annual influenza vaccination program. For COVID-19, we are ready. Last week, the CDC issued recommendations that healthcare workers be top priority to receive the new vaccine. This is a smart approach to alleviating the impact of the pandemic on our communities. We need our healthcare workforce to stay healthy so they can continue providing care for our communities. Vaccination for healthcare workers will be voluntary. The first allocation of vaccine we receive will not be available to the general public. Please do not arrive at our facilities asking for it. As soon as we can, we will make it available to the public. We will do so. And we are as eager for that day as you are. Not only is the speed and breadth of vaccine development, including new vaccine technologies, unprecedented, so is this situation where vaccine is being distributed before regulatory review and research study publication. Therefore, before we give the first dose of vaccine, we will await FDA review and issuing of emergency use authorizations. Until they do so, we will safely store the vaccines we receive. Our team of virus and vaccine experts are performing an internal evaluation of the clinical trial data available on the vaccine. Until they are satisfied that the vaccine is safe and appropriate for the people we plan to offer it to, we will not be injecting it into anyone's arms. Speed is important, but so is safety. We will closely monitor our vaccinated healthcare workers to confirm the safety and efficacy reported by the manufacturers. Because the University of Pittsburgh is a local site for many of the vaccine trials, and many of our staff volunteered to participate, we've heard that some participants experience a fever, fatigue, and/or malaise or arm pain after vaccination that may be intense enough to require a day or two off of work. This is a normal and healthy immune response to some vaccines, and we will plan our administration schedule accordingly. I cannot stress enough that while the ability to offer a highly effective COVID-19 vaccine is truly fantastic news, it does not mean that we can stop wearing masks, distancing, and washing our hands. These fundamental interventions work together with vaccines and monoclonal antibodies to bring an end to the pandemic. Dr. Yealy will tell you more about monoclonal antibodies.
Thank you, Dr. Snyder. Like you, I'm very excited about the promising vaccine news. However, even under the best case scenario, it will likely be months before everyone who wants and should get a COVID-19 vaccine can actually receive one. We expect that there'll be many people who will opt out and not want to be immunized. We will do everything we can to educate and encourage. We think this is helpful, but we recognize that many will decline this opportunity. So what's clear? We must continue the basic public health practices that we know protect us and are needed now, particularly during this holiday season. Wear a mask whenever you're around anyone who's not in your household, and wear it properly. It must cover your nose and your mouth, not just one. If someone in your household recently tested positive for COVID-19, or if they have symptoms such as fever, cough, breathing difficulty, headache, smell or taste changes, or many of the other COVID-19 symptoms, wear a mask even inside your own house. Practice safe distancing and avoid gathering with people that you do not live with. We recognize how hard that is during the holiday season. This is a critical time. We need to do it. Wash your hands often. Stay home when you're sick and call your physician to be evaluated so that you can decide whether or not you need COVID-19 testing. At UPMC and at other academic medical centers, we will continue to develop and deploy therapies, particularly things that can treat and prevent COVID-19, and that includes antibody therapies. UPMC just received an allocation of 2 different antibody treatments from Regeneron and Eli Lilly, which we are giving to certain COVID-19 infected patients. We are also developing our own antibodies, AB1 and AB8, because we think they have the potential to be much more powerful than the current therapies. Antibodies hold the promise of being curative for those who are COVID-19 positive. And unlike vaccines, which are preventative, they don't require you to mount any type of response to be effective. We expect to begin our clinical trials soon. Finally, one last important point remains. Take care of yourself. Keep your doctor appointments and get all the needed care that is possible, especially your preventative care. If your doctor believes you need a medical procedure, schedule it. Don't delay. The care is important, it's essential, and UPMC can give you that care safely. If you're having a medical emergency, go to the nearest emergency department immediately. Don't risk your health by waiting. Our UPMC facilities are safe. We will get through this together.
Okay, thank you, doctors. Thank you, Leslie. And now we'll take questions from the media. To ask a question, you'll have to go to the participants icon at the bottom of the page and press the Raise Your Hand button. That will put you in the queue. I will read your name and your line will be unmuted for you to ask your question. Please remember to unmute your microphone on your end. We'll try to call on as many people as we can from as many different outlets as we can in the time we have allotted. So again, press the Raise Your Hand button and we will be able to put you in the queue to ask your question. First question I have is an email question. Dr. Snyder, you mentioned prioritizing healthcare workers for vaccine, but the CDC also said people living in long-term care facilities should receive priority. Will you be vaccinating residents of UPMC senior communities?
Yes. There are 2 vaccines that we're receiving. The Pfizer vaccine is being received in our hospitals, and the Moderna vaccine is being received in our skilled nursing facilities. Right now, our receipt of the Moderna vaccine is coming a little after the receipt of the Pfizer vaccine. It's important that since we have multiple options for vaccination, that, and these are 2-dose vaccines, that an individual get the first and second dose with the same vaccine. Therefore, our approach is to develop 2 different prioritizations for both the Pfizer vaccine in our hospitals and associated settings and for skilled nursing facilities. For the Pfizer vaccine, we will be prioritizing for healthcare workers, and for our skilled nursing facilities, we will be prioritizing for healthcare workers and patients. It's important, though, that we are still waiting further data on both how safe and how well the vaccines work, including, importantly, the way they work in our most vulnerable individuals, the elderly. That information will be key to understanding and developing the prioritization scheme for our skilled nursing facilities.
Okay, thank you, Graham. First question, Nick Kepler from the Washington Post. Nick, please go ahead. Nick, please unmute the microphone on your end. We're not getting it? Okay, let's go to the next question. Leonard Bernstein from the Washington Post. Lenny, please go ahead. Are we unmuted? Okay. Let me ask the next email question we received, and we'll go on after that. Recently, the Pennsylvania Department of Health issued an order that could prompt a 50% reduction in elective surgeries. Do you anticipate that planned procedures may need to be postponed? Leslie, you want to take that?
Yeah, thanks, Paul. Well, we can only speak for our experiences at UPMC. And at UPMC, we have no need to delay or change planned procedures. Deciding to postpone a scheduled procedure is a complex decision, and it's best made between their physician and patient rather than broadly mandated. And some so-called elective procedures, if delayed, could put a patient in harm's way. Look, surgery is a very serious thing, and people decide to have surgery when they have very serious conditions. According to our data, postponing scheduled procedures will not create any capacity for COVID-19 patients. We treat COVID-19 patients, obviously, outside of the operating rooms. They're in medical units. They're very safe. And so there's absolutely no reason to change what we're doing now. If needed, and if things continue to progress, we continue to take a very focused and tailored approach to each of our hospitals. But postponing surgery is never a good idea. And at UPMC, we are sure we can take care of all of the COVID and all of the non-COVID patients in our communities.
Okay, let's go back to my list of media questions. Let's try Paul Goff at the Pittsburgh Business Times. Paul, please go ahead.
Hi, can you hear me okay?
We can hear you, Paul.
Thank you, Paul. Thanks for taking the time. I wanted to know how long will it take to start the vaccinations? You mentioned that, Dr. Snyder, a little bit, but for UPMC employees and the senior communities, and then how long do you think it'll take to be completed? Because that's a question, I think, not only of logistics on your end, but also shipments and when you might expect those.
There are several steps that we have to meet before we can start to give vaccines. First, we have to have the EUAs, the emergency use authorizations. That's the government's, the FDA saying that we are okaying these vaccines for use after clinical trials. That's first. Second, we have convened our group of experts to independently review the data on these vaccines. I want our experts in viral infections, in vaccines, in clinical trials to tell us that the vaccines are safe and effective to use in our communities. The third will be receipt of the vaccines. Now, we have not yet received vaccines in our facilities, but they are on their way. And the Pfizer vaccine is being shipped, at least for our communities in Pennsylvania, sooner than the Moderna vaccine. All three of those things have to happen before we can start administering vaccines. What I will say is that our teams have been hard at work, everything from supply chain to our clinical experts to our employee health teams, to prepare to give the vaccine as soon as those criteria are met. I anticipate that this will all happen very soon, within the next couple weeks. To answer your second question, we do not know how much allocation will be coming after this first allocation and the frequency with which it will be coming. So it's impossible to predict when we will be able to vaccinate everybody. However, given what we understand about manufacturer development of the vaccine and production of the vaccine and plans for distribution, we are optimistic that we will be able to vaccinate our healthcare workforce very soon.
Okay, next question. David Wenner, Penn Live and Harrisburg Patriot News. David, please go ahead. David?
Yes, can you hear me?
We can hear you. Please go ahead.
Hey, by the way, I asked this question with the assumption that you require your employees to get regular flu vaccine. But the question is, why wouldn't you require your employees to get the COVID vaccine?
I think it's appropriate to compare and contrast with the flu vaccine. Yes, as an organization, UPMC does have a mandatory vaccination policy in place for its healthcare workers for influenza. But that is based on decades of experience with the influenza vaccine, including how safe the vaccine is and how well it works. It's also based on a tremendous amount of research trying to get healthcare workers to improve their uptake of the vaccine and the impact of mandatory vaccination policies. Put differently, we know exactly how safe and how effective and what a mandatory vaccination policy does for the well-being of our community for influenza. Compare that to COVID-19 vaccine. While we're very excited about the preliminary information we have about how safe the vaccine is and how well it will work, we don't have any of that other data that we have based a mandatory influenza vaccine policy on. So for now, until we learn more and build our own experience with this vaccine, plus until we see the uptake of the vaccine in our communities and have an understanding about the role that vaccination has in ending this pandemic, it's not the right thing to make it mandatory. It'll be voluntary.
So we're going to go back to Lenny Bernstein of the Washington Post. He has now texted his question to us, and this is for Graham. How long will the review of the data delay the first vaccination after the EUA?
I don't anticipate that the expert review will delay very much at all. The folks that we have reviewing the data that's coming out are eagerly consuming the data the very second it comes in. And these are also experts in vaccine clinical trials, in vaccine efficacy studies, and in healthcare worker vaccination, among other topics. So they are very eager to see this data. They've been ready to see it, and in some cases have a good estimation of what's been happening. So I think that review is going to happen very, very quickly.
Great. Next question, Amy Wattis, KDKA TV. Amy, please go ahead.
Hello, can you hear me?
We can, Amy. Go ahead.
Thank you. Yeah, my question is more about vaccine storage. I know you said Pfizer will be stored in the hospitals, Moderna in the long-term care facilities. Can you explain specifically how storage will be taking place within your hospitals when it comes to Pfizer's vaccine as far as freezers go? I don't know if you can say how many freezers your hospitals combined will have and that whole handling process because of the frigid temperatures that this vaccine needs to be held in.
There's an important message to make about distribution and administration of vaccines, and that is even though these two vaccines that we're anticipating receiving have specific requirements, in the case of Pfizer, very cold storage, the notion that you have to prepare for the cold chain and the distribution of vaccine is nothing new at all. That actually is an issue with distribution of vaccine for a million different types of vaccines in a million different settings. Our teams are prepared to take whatever vaccines and requirements that come with them and distribute them. In the case of the Pfizer vaccine, yes, it does mean that we had to procure some additional ultra-cold storage for the vaccines, but we're ready to receive the vaccines at the facilities that are receiving them, and we're ready to maintain the cold chain from storage to administration.
Okay, thank you. Next question is from Rachel Yankunas from WPMT TV in Harrisburg. Rachel, please go ahead.
Hi there, do you have me?
We do, Rachel. Please go ahead.
Thank you so much for taking my question. Just a follow-up question on that, two parts. One, how many freezers does UPMC have to store these coronavirus vaccines? And is there a plan in place once healthcare workers are vaccinated and the priority groups are vaccinated? Is there a plan in place to vaccinate the general public? Will it be at these UPMC facilities or elsewhere?
Yeah, as our allocation has been changing, we're getting more information from the government and regulatory bodies about the vaccines that we're receiving. We're constantly adapting the preparations that we're making to make sure that any of the vaccine that we are allocated, we will say yes to and administer it to our communities. So that actually is a fluid number based on what we've learned over the last several weeks. As far as how we're going to follow healthcare workers afterwards, we're interested in knowing how well the vaccine works and following both the safety and how well it works to prevent infection after administration. So we will be following healthcare workers. The second question.
How many freezers?
How many freezers?
How many
do we
freezers
have?
is number one? And number two?
Enough.
Do we have enough?
Enough is the answer.
Enough.
Yes.
Oh, public prioritizations. Thank you. So I call your attention again to the ACIP guidance on staging the distribution of these vaccines. Right now, we're entirely focused on Phase 1A, healthcare workers and the vulnerable populations in skilled nursing facilities. Phase 1B is other essential workers, and then Phase 1C is other vulnerable people in the community, including people over the age of 65 and people with underlying medical conditions that may predispose them to complications. Right now, we're working very hard on allocating the vaccine that we're getting for healthcare workers, and I think that's going to be the next 1 to 2 months' work at least. And so we will build as we understand allocations coming to us, preparations to administer vaccine to the community as well when that time comes.
Thank you. Another email question from WICU TV in Erie, Pennsylvania. If Erie has a large outbreak of COVID and beds are filled, how will UPMC approach the treatment of those cases? Leslie?
Well, in all of our communities, we're doing the same thing. We're anticipating more patients by reopening beds. We have beds that have been closed and out of service because of less need for hospital beds, and now we've been reopening them. We've been adding staff, we're adding nurses, we're securing our personal protective equipment, we're adding equipment where needed. So we have absolutely no concerns that there will not be enough facilities or nurses to care for all of the great residents of Erie. And that's, again, part of what's so positive about being part of a larger system, that we're able to move resources wherever the patient's needs are.
I think what's important to highlight, a large academic medical center like UPMC uses multiple strategies to help each individual site. That's improving the resources, both human and physical, at a site, improving the decision-making about who gets care and how it's delivered, improving and using technologies like telehealth to allow care to happen in different ways, and then leveraging hospitals nearby and further within our system to make sure there's a multi-pronged approach that really is fail-safe.
Let's go to Jamie Martinez from Spotlight, PA. Jamie, please go ahead.
Hi, thanks for taking my question. We're here in Pittsburgh, but I know UPMC has a number of facilities around the state, especially in rural areas. Some federal HHS data that was released just within the past day shows that Tioga County and other rural areas of the state seem to be at or exceeding capacity in terms of hospital beds, both ICU and other medical and surgical beds. So can you talk a little bit about how the network is supporting people in rural areas and some of the challenges you might be facing in parts of the state that aren't our big cities like Pittsburgh?
Sure. Some of the challenges in the rural areas are really what many of our hospitals in other cities felt in urban areas at the beginning of the pandemic, except the difference now is we are better equipped to deal with this virus. We feel secure about our testing, about our capabilities, about our tracing, about our personal protective equipment, about the number of beds we have. As we said earlier, less patients are being treated with mechanical ventilation. Less patients require intensive care units. So I can only speak for UPMC. We're busy, but we are not overwhelmed in any way. There's really a calm feeling among our hospitals, whether it's North Central Pennsylvania, Central Pennsylvania, the Altoona region, the Western Maryland region. These are areas that have become much busier, and they're doing a superb job caring for all of the COVID and non-COVID patients.
Okay, thank you. Next question, Bill Kibler, the Altoona Mirror. Bill, please go ahead. Bill, please unmute on your end.
Can you hear me?
We can now, Bill. Go ahead.
Okay, thank you. Can you talk a little bit more about your plan to shrink the quarantine period for healthcare workers from 10 to 7 days, or from 14 to 10 and then to 7 days?
So from an infection prevention standpoint, when we talk about an individual who's exposed, we typically keep that person out of work for as long as they may develop the disease and become contagious. As the science of this virus has changed, we're understanding more about that, what we call the incubation period. So initially, we quickly learned that the incubation period was 2 to 14 days, but as we have more refined data, we know that it's unusual for somebody to develop symptoms as late as 14 days. So before the CDC's guidance, we looked at our own data and how our own employees fared after a potential exposure, whether that be a home exposure, community exposure, or workplace exposure. And for our own organization, decided that it would be safe to bring healthcare workers who remain asymptomatic after 10 days back to work day 11, 12, 13, 14. My job is to prevent transmission in our hospitals. So that would not have been a change that we would have made if I thought there was a substantial risk of increasing transmission in our hospitals. And the CDC's statement and data supporting it validated that approach. With the CDC's guidance, we're of course revisiting that, including with additional data to support their new approach, and exploring if we can safely bring back healthcare workers after 7 days. Again, the focus here is to be able to provide care safely, but at the same time maintain a workforce so that we can provide the care we need to our communities.
Okay. Next question from Chandy Chapman from WTAE-TV. Chandy, please go ahead.
Hello, can you hear me?
We can. Please go ahead.
Okay. I know you talked a little bit about bed capacity and at UPMC Mercy, how you're expending that bed capacity, but how are you managing bed capacity, especially at places like UPMC Jameson, where the state health department report shows there are no more ICU beds left? Where do people go who need that type of care, or do you shift the resources like you mentioned before? I know last month you said there were 90 beds, 14 COVID-19 cases at that facility, and you weren't at capacity, but I'm specifically talking about ICU beds left and what's the plan for facilities like UPMC Jameson?
Okay, thank you. Again, we are not taking care of the majority of COVID-19 patients in intensive care units. They don't require that. So today, we have about 25% of all of the COVID-19 positive patients across UPMC in intensive care beds. But that means 75% of them are in regular beds. And we have close to 6,000 beds at UPMC, and I think 20% of them are now filled with COVID patients. So again, those broad numbers give you a sense that there is no need to feel nervous or anxious. We are not overwhelmed with this virus. We've been taking care of very sick patients for many, many years, and we're vigilant. We know how serious this is. We take care of each and every patient and their family, but we're hopeful that with some of these new technologies and vaccines, that this will be way past us within a few months.
Next question, Mark Goshgarian from Spectrum News in Buffalo, New York. Mark, please go ahead.
Okay, hello, can you hear me?
Hello, Mark, please go ahead.
Leslie, I work for Spectrum News Buffalo out of our Jamestown newsroom, and a lot of your comments have been centered around your Pennsylvania communities. My question is about your New York communities, UPMC, Chautauqua. As the number of COVID cases increase now in this area, just 90, we're getting into the double digits. Try to give us a progress report, if you can, about UPMC Chautauqua. Are you adding that same staffing? And Governor Cuomo mandated hospitals to expand their bed capacity by 25%. How is that going? And can you sort of talk a little bit about that community?
Yeah, thank you for reminding us about our wonderful hospital in Southwest New York, WCA. They're doing a great job. The numbers have gone up, but they're within their bed capacity. They're doing just fine. We've been able to help them through the resources of Northwest Hospital, which is on the closer to the New York border, but in Pennsylvania, and as well as UPMC Hammett. So they're fine. There's no issue for us in New York.
Next question comes from Chris Mamula, Pittsburgh Post-Gazette. Chris, please go ahead. Chris, please unmute. Okay.
Yes,
Oh,
thank you.
here we go.
A question for Leslie. If you could just elaborate a little bit, you mentioned Altoona and some of the sister hospitals that were helping Altoona deal with the cases there. Can you explain that a little bit, what that means? Like, is it the contributing staff from nearby hospitals, or how does that work?
Thanks, Chris. Yes, all of that. We have added about 60 nurses to the Altoona milieu, so they have new staff as of last Wednesday. We are opening up new medical beds at Somerset Hospital, which is only about 30 minutes away, and so that gives us a little bit of a valve for Altoona. We added more testing equipment at Altoona. We sent a few ventilators over just in case they need them, but they haven't. So we sort of stand at the ready. We're here to help them in any way. And by the way, the staff is just amazing. I mean, the nurses are incredible. They're so engaged. I mean, they are thrilled to be able to provide such high level and high quality care to each and every patient at Altoona Hospital.
Here we have a follow-up question from Leonard Bernstein at the Washington Post. Lenny, let's try it again. Please go ahead.
Can you hear me?
We can. Please go ahead.
Great. Thanks for taking my question. For Dr. Yealy, why is Pitt developing its own monoclonal antibodies? And would this therapy be available during the current pandemic? I know you mentioned you're just beginning your trial, but is this going to be accelerated to the point where this therapy will be available, say mid this year?
Well, thanks very much for the question. And the simple answer is that while we're all excited about the current antibodies that are available from both Regeneron and Eli Lilly, we think there's still much more space in this particular area. That is, there'll be ongoing need. Vaccination alone will not likely solve all of the issues, and antibody therapy will be important. And we think there's an opportunity to make even better antibodies that are easier to deliver, more effective, and more long-lasting. The thing about antibody interventions is they provide the immunologic response instead of depending upon your body learning and delivering that response. That's very important not only to prevent disease, but to treat the disease in the most vulnerable who often can't mount that same response. We think the ideas that we have about antibody therapy may actually improve upon what's already available. I wish the pandemic was going to be gone in a month or two, and this would all be interesting conversation. I don't think that COVID-19 will be completely behind us for a long period of time. I see promise, but I think there'll still be need for better therapies, including better antibody therapy. So Pitt and UPMC are both committed to that.
Next question is a follow-up question from David Wenner at Penn Live. David, please go ahead.
Thanks again. In order to have sufficient staffing, have you had to use any measures such as mandatory overtime or say postponing vacations or time off?
We've thought about some of that, but we haven't had to do that yet. So far, we've been able to secure enough staff through those who voluntarily would like to work overtime. And again, with our 92,000 employees and probably 2/3 of them have some type of clinical background, there have been a lot of people who have raised their hand and said, this is what I do and this is what I want to do at UPMC. So we have had people who have volunteered to take extra shifts, who have volunteered to work at other sites within our hospitals. For example, our children's hospital, as you know, this is not a disease of children per se, and so the pediatric nurses have asked to work in many of our adult hospitals, and they're very well trained. So that's been a great opportunity for us.
Thank you. Next question, Danny Fitzgerald from the Beaver County Times. Danny, please go ahead.
Great. Can you hear me okay?
We can. Please go ahead, Danny.
Okay, great. Thanks. Question about the vaccines. Do you know how a number of vaccines you'll be receiving? I don't know if you can know that or not. As well as I understand that the employees at UPMC will be receiving them voluntarily. How does that work? Is that something that people can just sign up to receive them, or is it we're going to be asked the day of when they come in? How is that determined? And also, will you be receiving more once UPMC employees have those vaccines? Will you be receiving more afterwards, or is that just dependent on the trials that are still going on?
Yeah, so the number of vaccines that we're receiving is constantly evolving, and I think in a good way, because as our Department of Health in Pennsylvania in particular is working on the distribution, those numbers are increasing. We already anticipate receiving thousands to tens of thousands of vaccines. So it's very exciting for us to be able to offer the vaccine to those areas and healthcare workers where it will benefit most. Now, it is voluntary, but we understand that people may change their mind as more information about the vaccine becomes available and as our own experience in the organization grows. So if somebody has initially has been offered the vaccine in the prioritization and declined, but changes their mind, we'll have them right back in the prioritization line where they were so that they can get the vaccine. We have a commitment that the vaccines that we're receiving now, we will receive the paired second vaccine as well. So the vaccines that we're administering now, we fully anticipate that we will be able to vaccinate those same healthcare workers for their second dose.
Next question, Holly Patterson of the Greenville Record-Argus. Holly, please go ahead.
Good morning. I'm worried about the flu season as it is now starting to get into full swing, and how it's being affected by COVID, and what parents should be thinking about, as if they're taking their children in for flu shots, do they still need to do that? Things like that.
So absolutely, you still need to have all the same precautions, including vaccination for influenza. The symptoms of influenza can look very much like COVID-19. You won't be able to reliably tell them apart. What we know in the communities that we serve at UPMC is that there's been very little influenza activity, and we've been looking for it, and we just haven't found much of it existing yet. That doesn't mean that it won't come. Perhaps the activities that we do to mitigate COVID-19, wearing the mask, keeping distant, not going out when you're sick, will also help dampen down the flu season. I can't know that yet. We know in the southern hemisphere, which generally has influenza before us, the season wasn't intense. Do all the same things to keep your children and yourself safe. Get that vaccination, do the smart things. We don't know which way this will go, and together you can get influenza and COVID-19, and that would be a difficult ride for almost anyone.
Okay. Next question, Maria Simbra, KDKA TV. Maria, please go ahead.
Good morning.
Good morning.
Good morning. Question for Leslie Davis. So you mentioned that you are increasing the nursing staff. You've brought in some nurses. Could you just talk about where the nurses are coming from, and would this create shortages in the places that they're coming from?
No. I mean, the nurses are coming from all over. We have a lot of nurses that work within UPMC who have clinical nursing backgrounds and are not working at the bedside. And they have volunteered to move back and work at the bedside. We have other nurses who work what's called flex part-time. And we've done that to be flexible in the marketplace and competitive. And those nurses are now working full-time instead of part-time. So that gives us several hundred nurses. We use agency nurses like everyone else does, travelers, folks who come here for 6 or 8 weeks for an assignment, and who may have a particular experience with COVID-19 because they've worked in other parts of the country. It's all of the above.
Thank you. We have a follow-up question from Mark Goshgarian at Spectrum News in Buffalo. Mark, please go ahead. Mark, please unmute on your end.
Can you hear me?
We can hear you now. Please go.
Okay, great. Dr. Snyder, with regards to the vaccinations, being in New York, how do you work, I guess? Do you work with the New York State Health Department? Is it separate? Because you mentioned the Pennsylvania Health Department. How do you get those vaccines to your folks in this community here? How does that relationship work?
Of course. So, yes, so for our communities in Maryland and New York, we work with the respective agencies in those states with their distribution models. Our approach to prioritizing the vaccine will be the same across the network, but of course we have to work within the distribution models for those states.
Okay, and our final question comes from Chandy Chapman of WTA TV. Chandy, please go ahead.
Thanks so much. I wanted to see if you could talk more about the dedicated COVID-19 recovery unit at Seneca Place. How are things going there? Are there any type of issues? And who are the non-UPMC agency teams? Just kind of giving a status update on what's going on with that recovery unit.
I'll start. So we have several post-acute units as well as obviously hospital units. And there are many patients who require a little more care, but are not quite ready to go home and may not be accepted by other skilled nursing facilities because they need to have 2 negative COVID tests. And so we decided that the best way to care for our UPMC patients was to create a space that would be safe and help them continue to recover. And so Seneca Place, which is one of our skilled nursing facilities, is taking care of those patients, and they're doing a great job.
Okay, thank you, Leslie. Thank you, Dr. Snyder. Thank you, Dr. Ely, for your time today. And that concludes all the time that we have allotted. In about 45 minutes, we will email media attendees a link to download high-definition footage of this entire press briefing, which we encourage you to use in your news reports. Reporters with follow-up questions are encouraged to contact our UPMC Media Relations Department at upmc.com/media. And please remember to follow @UPMC News on Twitter for frequent updates. Thank you very much.